So guys, gout. Gout and septic arthritis, don't get them confused. There are two different things. Or you might think, why am I saying gout and septic arthritis? It's because in the exam question, it can be very confusing and you can think, oh, is it gout or is it septic arthritis? Key points. For gout, it affects one joint. Septic arthritis affects one joint. But there's a differences. For gout, you will have swelling, you will have redness, you will have pain. With septic arthritis, you will have other things. Swelling is there, pain is there, redness is there, but the patient may be unwell. The patient might have fever. Okay? The patient might be immunocompromised, like might have diabetes. Very important. Patient may have rheumatoid arthritis. Plab 1 example. This is a risk factor. There are several risk factors. Please refer to our video, full video for gout and septic arthritis. But risk factor very important for a Plab 1 rheumatoid factor, arthritis. So for gout, we know that there is a high level of uric acid. Okay? Commonly can affect the big toe or the ear pinna. Investigation for gout. It is not the most definitive investigation. It is not high uric acid. A normal uric acid, a person can still have gout. So a high uric acid is not the best investigation. The best one is going to be joint aspiration for culture and sensitivity, in which you will see negative bifringate crystals. Treatment for gout depends on the patient's medical history. Generally, we give the patient NSAID. If the patient can't take NSAIDs, maybe they have heart failure, maybe they have allergy to NSAID, maybe they are asthmatic, can't take NSAID, colchicine is there. If the patient has renal failure, you can't give them NSAID, you can't give them colchicine, then going to be steroids. Some patients, they tend to have recurrent gout, such as those who have chemotherapy. They have something called tumor lysis syndrome. So in chemotherapy, as you know, you kill all the cells, okay? The DNA gets broken down, you have high uric acid. So these patients will be prone to gout. So to prevent that, as a prophylaxis, we have something called allopurinol. Key thing for exam, don't start a patient on allopurinol in acute gout. Patient X comes with gout. He needs a prophylaxis as well because he's having a recurrent. He has an acute gout. You treat him. Once the flare-up is gone, then you can start him on allopurinol as a prophylaxis. Another patient is taking allopurinol because of prophylaxis. He has gout, acute gout. You treat him, don't stop allopurinol. So guys, very important. Septic arthritis and gout. Just don't get them confused. Okay? Please see the full lectures and all the best.